I'm Rebecca McEnroy, and I'm the host of American Compassion. And one of the more challenging aspects about producing a show on the American safety net is that it requires us to look very closely at the gaps in care, the places where people are struggling, where systems are strained, where uncertainty and suffering are all too common. And that's very painful to do, as all of you know, and especially people on this panel as well. But as Leonard Cohen reminds us, ring the bells that still can ring, forget your perfect offering, there's a crack in everything. And that's how the light gets in. Throughout the history of the American safety net, we've seen time and again that wherever there are cracks, there is also light, illuminating both where help is needed and those who are determined to make things better. As we wrap season 3, we have the opportunity to shine that light on 4 remarkable leaders who have not only faced challenges themselves, but they are building bold and independent solutions to some of the safety net's most complex problems. They're not just filling gaps, they're transforming care. They're using emerging technologies and innovating to modernize the safety net and make it more efficient, more human-centered, and more responsive to those who rely on it most. Today, we'll hear what inspires their work, what sustains them, and how they're navigating both the obstacles and the opportunities in front of them. So, who's doing it best? Well, they're right here with me. Amber Lombardi is the CEO and founder of Mainely Teeth. It's a nonprofit bringing community-based access to quality dental care through an innovative model that combines brick-and-mortar offices with mobile clinics and teledentistry technology. Welcome, Amber.
Thank you.
It's good to have you. Adrien Lewis, right beside her on the end there, is the founder and president of CarePortal. It's a software platform that connects families in need with resources and support in their communities, helping keep kids out of the foster care system. Adrien, it's great to have you. Thank you for coming.
Thank you, ma'am.
Julian Paraschiv, who is right next to Amber, is the founder of AIDA Healthcare, a software platform that's improving care coordination and easing the transition from hospital to long-term post-acute care for patients and providers. He's going to explain a little bit more of that because that's kind of a difficult thing to wrap your head around, but we're so glad you could join us. Thank you, Julian.
Thank you for having me.
And last, but certainly not least, Erine Gray is the founder and CEO of Findhelp. And Findhelp is a software platform that enables community organizations, governments, healthcare organizations, and businesses across industries to easily manage and coordinate care. Please welcome everyone to our panel today. So, all of you have such incredible stories that have led you to the work that you're doing today. Adrien, you not only help to keep kids out of the foster care system, you also have adopted 3 children yourself, and you work with faith-based communities to provide a support system that reflects that it does take a village, a very robust village. And you're also using technology in interesting ways to support kids who are vulnerable to going into the foster care system and to keep kids out of the foster care system. What was that aha moment for you? Talk a little bit about your history and what brought you to the work that you're doing.
Sure. So I was a business guy, kind of minding my own business, running things and making money and climbing the ladder and doing all the stuff you do in America. And I took a mission trip to Haiti that really reshaped my perspective. It showed me that really all of my best efforts in this life I've created were not a result of my awesomeness. I happened to be born where I was born, to the people I was born to, and given all kinds of opportunity. And the folks in Haiti who I met, who had tons of resilience, had very little opportunity. And it just shook my perspective. I would say it humbled me. And that humbling process began a journey for me to see other people differently, and maybe even before myself, which ultimately led my wife and I to leave my business and join the ministry that we went to Haiti with and A little while after that, we really felt led to take the foster care class, which we knew very little about. But what we did know is there are kids in our community who don't have what we have, and maybe not anybody to love them. And so we went down this path of fostering, and that led to us opening our minds to, well, how might we help other people come alongside these kids who don't have family or have family that's broken or could use some help getting back to their family. And long story, not quite as long, we started to imagine what the barriers were. And for someone to open their home to become a foster parent, it's like a 6-foot barrier. Like, it's really high, it's really hard. There's lots of things to be afraid of. And it's not for everyone. We certainly felt called to do that. But if we could remove some of that, if we could make a 6-foot barrier a 6-inch barrier, and we could say to anyone in the community, if you knew of the needs of someone in your community who could keep their kids out of foster care if they got some of the things that they needed, beds, transportation, etc. If you knew of a grandma in your zip code who just took her grandkids in, but in order for her to keep them, she needs to shore up their safety in her home. If you knew of those real needs in real time, would you act? And our bet was that people would say yes, they would act. And so we created a technology platform. Much like Uber connects riders and drivers, we created a platform that connects kids and families in crisis with churches and businesses and people who care in proximity. When they see those needs, they have the opportunity to respond, but not the obligation. And what we've seen over the last decade is over 500,000 people served through people in the communities, neighbors seeing and serving their neighbors. And it's been an absolutely amazing journey.
And being able to see a change, being able to see your actions change a life for the better. I mean, that is a remarkably profound and powerful thing. So you've given not only that ability for people to help, but that opportunity for them to be involved to make a difference. It's really quite remarkable.
Yeah, thanks.
Amber, Haiti plays a big role in your story as well.
Yes.
You come from a family of dentists, and you worked a lot in your youth in Haiti.
Yes.
And I mean, I want you to tell this. I want to tell the whole story myself, but I want you to tell us a little bit about that experience and then that aha moment when you were like, oh, wait, we're not doing it right here, and I know how to do it better.
Yeah, I grew up in a dental family, as I call it. My parents, they created everything they had themselves from the ground up, and they were very hard workers, but they also were very service oriented. So I grew up in a household where we did acts of service, and that was just kind of our way of life. And little did I know how much I was learning from them during that time as I grew. As a child, I grew up in the office, so I was made to work to do the mundane things, and we worked as a family. And my parents would do a lot of pro bono work, and over the years, my father started to work with the Haitian Health Foundation and helped contribute to building a clinic they have out there. And when I got old enough, he started to take me on trips with him, and we would just go do street dentistry on the street. We would start caring for people, go into the mountains and care for people. People would walk sometimes days to see us for care, just to get a tooth out. So I didn't know it at the time that, this wasn't the first career that I had. But I knew that I loved people. I knew that I could care for people. And I was really moved how do a lot with a little. And that's something that I really took with me throughout my life now and how I work now. And so when I went back to school, and I realized that I wanted to do dentistry, and I was in a public health class. I didn't know that it was public health that I wanted. I didn't really understand what public health was. And I remember the first class I sat in, I just had this really aha moment. And I when I figured out what it was, I said, oh, this is what I'm going to dedicate my life to. But I knew that if I made it through school and I did what my heart was really saying, that I didn't want to be inside four walls. I wanted to care for people. I was really confused at how we ended up. I mean, you can look back at the history of how, but it was not glaringly obvious to me how we ended up in such a sterile type environment to give care to people. So I knew I wanted to do it differently. I wanted to do street dentistry, but here, and start going to people. So I started, I just, out of my truck, I had portable equipment. When I graduated, I went out on my own and I just started seeing bedbound patients, a lot of special needs, adults and children that needed to be seen in their homes first to establish relationships. And so that really, Haiti was really empowering for me, and how I viewed how to care for people, and taught me that you can do a lot with a little. And so I kept that in mind, and that's kind of brought me to now, and that's why I started with mobile dentistry. That's always been kind of my path, and over the years it's transformed. We now have 2 mobile clinics, we have 3 brick and mortar offices, and there still is space for all the other stuff, but I'm still very passionate about mobile care and using technology to reach people in places that don't have access. So access to care is incredibly important to me. Breaking down barriers and the human piece to what I do. I always say I don't just do teeth, because there's so much more to someone than just one thing. Like when you're caring for someone, we should be caring for them fully. And if we have these touch points to be with people, we need to fully utilize our time with people. So that's how Haiti ended up changing my life. And
I didn't know that.
Yeah.
Yeah. And one of the most remarkable things about your story as well is, and probably all of you have had interesting stories of things that happened during COVID,
Yes,
that have pivoted your practices and what you're doing. But when Maine came to you and said, we really want to start, mobile dentistry, we want to start teledentistry, other dentists had said no, because you know what, it's just not going to pay the bills, it's not
Right.
going to work. And you said, I don't want more money.
Right.
I just want the freedom to be able to do what I know how to do. And you were so well positioned
Yes.
to work during COVID as well.
Yeah, and I was already doing that work, but it wasn't really looked like, it was kind of looked down upon for doing that. People would just say, why are you doing this? Why would anyone want to do this? It's hard. The days are long. You don't get paid very well. Like, there's just so many, there's probably just like this huge long laundry list of why people wouldn't do it. And I understand that. But I had a whole nother list of why I should. And that list is so much bigger for me. So yeah, I was really well positioned. So COVID's tragic, but people started to turn to me and say, okay, we give you permission to do this. And then how do you do this? So it totally changed the trajectory of how I care for people very quickly. So that has been really hard to navigate, but it's been an incredible journey for me to see.
Chance favors the well-prepared.
Yeah.
Is that right? Is that the quote? Julian, let's move on to you, because COVID also played an interesting role in what you're doing right now. But your personal story, you emigrated to the United States with your family. Your mom was working in long-term care facilities. You started working as a nurse in long-term care facilities. Talk a little bit about what you were seeing. What problems were you seeing, and how did you know that you could fix it?
So not quite a nurse. I'm a very proud certified CNA, so a nursing assistant who supports people in the long-term care industry. It was a fun experience to get the certificate and get front seat experience in a healthcare industry in the United States. But yeah, my story starts with my parents immigrating here in late 90s, early 2000s. And when I moved here with my brothers, my mom was working as a caregiver in the elderly care industry, and we really wanted to help her start her own long-term care facility, and we did. It took a while, but we did. And in that process, just helping with engaging with families and physicians and getting the medications delivered on time from pharmacies and everything around a long-term care facility. There's also a part where we had to go to local referral sources, which means hospitals and nursing homes, and market our facility and say, look, we have so many beds available. These are the type of patients we can provide care for. And over the time, we've figured out that there's a group of people that are being ignored for whatever reasons, but one of those reasons was the finances. So when I was going to local hospitals, and this was in Washington State, when I was going to local hospitals in Seattle and saying, look, we can take care of patients that are requiring bariatric care or spinal cord injury as part of their care plan, or they need a feeding tube, or what they call complex cases. I noticed a pattern that all of the hospitals said that's all great, but there's so many providers like you out there, and we keep an Excel file in SharePoint on who has what availability, who can take what type of patients, and who can take what type of insurance. But they said that's not really the biggest problem, even though that is a problem. The biggest problem is that Medicaid patients are compensated for long-term care to providers, and the rates are low, and there's not a lot of providers who want to take Medicaid patients. So really, when you talk to hospitals, you see Medicaid patients on top of having complex care plan, stuck in hospitals for weeks, months, in some cases even years. And so one of the first hospitals that adopted our software, they had a patient in there for 3 years. And this was a person in their 30s who had a terrible accent, and their care plan was complex. And we ended up finding a facility for that patient within 30 minutes. Months later, I left the hospital, talked to my now co-founder Michael, and we said, I think there's a better way to do it in an Excel file. And we built a prototype, started engaging local providers. And one thing that we were told from the beginning is that it's hard to get providers to participate. A lot of these long-term care providers, caregivers, are people like my parents, immigrants who are not tech-friendly. So they needed a platform that is super easy to use, yet HIPAA compliant, so we protect the patient health information. And then, of course, a lot of them, as I said earlier, if they take care of Medicaid patients, if they break even, that's great for Medicaid patients. And so at no cost. So we built a prototype, launched it in Washington State first with local providers, and because it was free, they started joining. Having providers join, we're able to go back to hospitals and say, look, there's providers now. Do you want to send them referrals and engage with them? And then there's a whole other story there, because about 6 out of all the hospitals that I talked to that said that they wanted to use it if we built it, all of them said, we want it, but we don't want to be the first one. So then we end up convincing one hospital who said, you'll get it for free indefinitely, just be the first one. And they did, and then they were referenced, and then the second hospital joined, the third one, fourth one. And that's still part of the core of what we do today. But today we have grown beyond that, getting into working with hospitals and caregivers and social workers and learning about the complexities of getting a patient and a person, not just a patient, but a person from one place to another. It's has all of its complexities around PHI, protecting health information, getting accurate information back and forth between the next level of care provider and the hospital. And more importantly, hospitals said, great, we're using your software for these Medicaid patients, but we have another dozen types of providers that we help patients with, and that's skilled nursing, home health, inpatient rehab, critical access, all sorts of care transition needs. And hospitals have been, more importantly, social workers have been educating us how we can evolve and where we need to go. And today we're serving hospitals and health systems in 17 states. And post-acute providers, through the free model, have joined and used the product, used the platform at no cost to receive referrals today in 49 states.
Wow.
And there's Delaware. We're still waiting on Delaware to let us to join. Yeah.
Come on, Delaware. So here's the thing. Can you briefly just describe why it's a problem for people to stay long-term in hospitals?
Yeah, great question. So hospitals are legally responsible for that patient not just being thrown out in the street, which is a great thing. They can just say, we're done with your hospital needs, you're on your own now. And in fact, they get penalized if the patient gets readmitted to the hospital. So they're really responsible for helping that person when they leave the hospital to have the best possible outcome. And that's where you look at the financial status of the patient, their physical, clinical care needs, and the more care needs they have, the more complex it is to find a provider that's able to meet those needs. And mental health status, so if the patient has, if the person maybe has dementia, Alzheimer's, and they might have combative behaviors, or they're exit seeking, and they could be at harm for themselves and others. All of these things combined are, and again, underlining the financial status, makes it really hard for that hospital to make sure that this patient, when they leave, they're going to be safe. And then you have, on the other hand, you have providers across the country who, many of them, would be ready to take that patient today, but they don't have a clear way of connecting to that hospital. Very much like Adrien's story, right? It's really utilizing technology in a way to connect all the parties involved. And also very important part of the story is the person themselves, the patient. Federally, there's a patient choice regulation in place that patients have a choice to choose where they're going to go next. Yeah. And so all of these things have to be considered for that to work out. And I have to say, we haven't solved all the problems when the care transitions in general. I mean, there's so many edge cases. But yeah, today we've, I think last year we've reached 2 million referrals. Yeah. So we've been doubling year over year. So it's been a fun story.
Incredible. And Erine, I mean, your story is also about connecting people with resources. I mean, that was a huge part for you, that this aha moment when you were on the line with someone listening in to a call center and realized, why is there a gap here? Why can't this person get the resources that they need? And you sought out to fix that. Talk about that aha moment a little bit and what brought you to the work that you're doing with Findhelp.
Sure. So I went to the LBJ school and graduated, and shortly after I had a job with the Texas Health and Human Services Commission, who's embarked on an initiative to simplify the way people apply for Medicaid, the SNAP, TANF, and the CHIP program. The goal was to have a call center that people could call, allow people to apply for these benefits online, and also allow them a simple way to check the status of those benefits. And we were actually officed at the Southfield building, which is in South Austin. I think it's an 8-story building. And that entire building was filled with people that were just working on the problem of, trying to simplify how you process applications for millions of Texans. And the short of it was, Texas grows 20% every 10 years. The volume was going up. It was using new technology. But for a period of time, I managed a guy named Isaac, who is the manager of the quality control department of the call center. And I discovered a place to listen to calls, and in some cases was able to listen to them live. And what held everything in common is that nobody was an expert at the moment that they needed help. Most people are self-sufficient, but in life, everybody gets a curveball thrown at them sometime. But it was as if you wanted somebody to become an expert just to take care of themselves and their family. And even when they did know what was going on, sometimes the system just broke. And so I remember listening to a call where a woman from Houston was renewing her SNAP benefits, but because the state did not have enough employees to process those benefits, because there was such a demand during the financial crisis, her renewal appointment wasn't going to happen for a few weeks after her benefits were going to expire, which basically meant she didn't have the money to feed the food stamps to feed her family. That light bulb moment was, this problem is so enormous that if I wanted to have impact, it's not going to be through, the current channel that I was in. And so the idea was, could we just solve the information problem? And that was, could people understand which established options are available, like government programs, like food pantries and things like that? And could we convince enough people that run those programs to accept electronic referrals and then give people just the yes or a no? And so that's where Findhelp sort of came to it, is to try to solve some of that information problems. But it was from really just listening to those calls and seeing nobody's having a good experience.
Yeah. And also, you have background, of course, here with the LBJ School, but you have a background in computer science as well.
It is true. I did fail out of a good computer science program twice.
2 times.
I ended up graduating with a degree in economics, but I did have a lot of computer science courses, which led me to become a programmer out of college.
And you knew that, there are specific technologies that can help, which I think as things progress, you're all using technology in really interesting ways to help solve these gaps. Can you talk a little bit about the biggest challenges that you see, what new technologies or emerging technologies you're using, how they can be improved in order to do the work better, or how they're really working well? Adrien, what do you think?
Yeah, it's an interesting question. So I don't feel like our solution, CarePortal, is a cutting-edge technology. I mean, in fact, there is all kinds of multi-sided market platforms out there. You described one that you guys have. Findhelp is a version of one. What we're trying to do, though, is we're trying to fill a gap in the social sector where there are some technical limitations. Like, people aren't innovating in the social sector to connect people the same way they are in business, because in business there's dollars and cents that all add up, and you kind of make that thing work. And for us, we're a nonprofit. The reason why nobody's done what we do is because, well, there's not a lot of money in it. So you're not gonna run a business this way. So we're dependent on some fee for service, but also some philanthropy. I say all that to say, I don't sit here as this crazy innovator of technology. I sit here as an innovator of how to leverage technology to serve people in really effective ways. Like, that's the space that we're in. All that said, certainly we're all talking about AI a ton, and large language models and all those things, and we're really trying to figure out, like, how might we shorten the time span it takes for us to connect people in the most effective ways? How do we build these networks of care in more effective ways because we're able to leverage AI and large language models and things of that nature? And for me personally, this has become, my staff will tell you, like, did Adrien write that, or did ChatGPT write that? I call him Chatty now, because that's my nickname for how much I lean in with this thing. I guess I'm saying all this to say, I can't wait to see, in this age where people get fearful of what technology can do, I can't wait to see how we're going to leverage it to create as many meaningful connections as possible. Because the more technology gets embedded in all of what we do, the more essential meaningful connections between one person and another are going to become. So I even think about what Amber's describing. Her work of helping people with their teeth is like a cover for making this special, meaningful connection with people in their living room or wherever, right? And when only humans can do that, technology can't do that. So how can we leverage technology to make that happen as much as we can? Yeah. That's the quest I'm on.
And I love this idea. You're like, all of you are starting with, how do we solve a problem? Mm-hmm. How do we focus on this specific gap, this specific need, in order to solve the problem? And so the business models are all different. The business models change. Amber, you were mentioning last night that you recently just started to have to take insurance because that's what people need right now.
Yes.
And you were just taking Medicare and Medicaid before. So talk a little bit about the business models and how you've had to kind of work within different business models, maintaining that human-centered approach to care.
Yeah, that it's been very challenging. When I read my first business plan, it's comical because it's not even close. It's to what I'm doing now. We grew very quickly. We have a very large school-based program, so we're in over 100 schools, almost closer to 200 schools in the state. We are going to, shelters, housing developments, primary care offices. So we infiltrated already existing spaces where people are doing a lot of social service work and things like we have social workers on our team. We have, we've just have this massive team now. And at the base of all of this is technology has been the reason why I can grow, but keeping that human piece has been the challenge. So we're using technology to be the first touch point and to align the human experience after that. So one of the things that you mentioned that came of this was I started to do teledentistry, legally, might I add, and with permission from the state during COVID. It is now legal in the state. It took us a couple years to get that passed through, but it is now legal, which is very exciting because we were able to reach people in all 16 counties, and Maine is a very rural state. It's very densely populated in the south, but beyond that, there's not much else north. And a lot of people, you say, how can you do virtual dentistry? That is just like such a wild concept, but you have to reframe it and think of it as a touch point, like as a connection. So we are using technology to take our providers and people in our community to have them work to it's pushing them to work to their fullest scope. So there are a lot of very intelligent, educated, certified people that are not working to their scope of practice in the community. So we're harnessing that, taking technology and deploying them out into areas, into the community to collect data points. So we use intraoral cameras to collect photo, video. We can do synchronous, asynchronous, just like you do for a medical exam. And oftentimes you actually get a better view of the mouth because you have a camera in there and you can have an exam with a dentist during that time. We also collect things like, are they in pain? What is their decay risk? We're collecting their social determinants of health. Like we're doing all of those things in those encounters. So I started doing that. And so that is what teledentistry is. And then what it's done is we found over the years that we're able to keep approximately 80% of people healthy in their community where they're at without them walking through a brick and mortar door space. And we're getting to, we're working with like pregnant parents that we're starting that journey there and we're following from birth these kids all the way and making sure the families are healthy. So it's a community effort because we utilize school nurses in the community, CNAs, people that are running shelters. Like we're incorporating them. We're doing trainings for people to help us do screenings and use this technology because they're the people boots on the ground in the community. We're partnering with other grassroots organizations. We're getting these cameras, this technology in people's hands. And then to take it one step further, my newest venture is I partnered with Mouthwatch, which is the company that makes the intraoral cameras and hosts our teledentistry software to develop an app and we piloted in for foster kids. Actually, we have a lot of connections here. We are piloting it with kids that are coming into the system because all kids get, a medical screening and assessment, and there is a requirement for that for medical, but there isn't for dental. So we're trying to get that required, and we found that a lot of these providers, the community health workers, they have nowhere to go. There's no safety net. We have a lack of providers. We're in a very rural community. So even the places that maybe would have taken Medicaid, they're full up. They can't anymore, and that changes week by week. So how do you keep your finger on the pulse? How are these providers actually sending these kids places where they can actually get care when they have, raging infections in their mouths? And it's the systems, it just feels like it's this uphill battle constantly. So this is my new pet project is developing this app with Mouthwash and Dentistry One to create a triage app. So on your cell phone, your iPad, scan the QR code, click. It tells you which photos to take of your mouth. It gives you an oral health report, and it immediately sends a report and connects you with a care coordinator, a dentist, or a hygienist, which is essentially Mainely Teeth now. So I named it Mainely Connection. So that's our new product. And what it's been doing is we've been able to triage all these kids on the spot. They get connected with a dental home and people on my end. We have partnerships, and because of the lack of safety network that exists, we've actually, again, you do a lot with a little, right? So we've actually started to create our own safety network. So I started to band together with the other 6 nonprofits in the state, dental centers, and we're trying to spread out patient care so nobody's overloaded. And so we're using technology now to get to people, and they can use that technology. They can send in 10 reports if they want, but it also tracks people. It keeps tracks of these kids. No matter if they move to different resource parents and things like that. So we'll see where it goes, but it's in the pilot stage right now, but it's been super successful, and we've actually been able to get kids connected to full-time dental homes, and even if they move around, the state, and they're still connected, and DHHS gets a report that gets sent to their system, and so that's our new, but at the heart of everything I do, I'm very technology driven, because I do think that's going to make the change. That's going to help us change.
Yeah.
The
and
system.
We could do a whole show on why dentistry has been separate from the whole medical field, but just thinking about your dental health, your oral health, and the impact that has on your overall health. Like, you're addressing that, improving health, and then also mental health and economic possibility for each person. Because we all know our smile is the first thing that people see. And if you are not able to make a good connection, you may be missing out on a lot of opportunities. Yep. So by addressing this specific gap in care too, you're not only improving the overall health of the people in Maine, but you're also helping the economy, and you're helping mental health. And so it's quite a remarkable thing you've done. I would just say that right now. But speaking about these different economic models and how everyone has had to pivot, Julian, you have a really interesting story of not being able to find angel investors to support your mission, and that actually turned out to be a benefit in the end. Talk a little bit about how you maneuvered that.
Yeah, when we started AIDA, this was 2016 with some research, and then 2017 when we made it formal. At that time, AI was the new cool buzzword, and we thought, okay, let's put it in the name. It'll be easier to raise funds from investors. It didn't matter. So the original abbreviation of AIDA was Artificial Intelligence Discharge Agent. Later we learned that there's other meanings behind this abbreviation, including an opera, but it was also from Latin. I think it means to take care of one. So I wish I could say that it was the latter one, the Latin version, but it was the. So anyway, we went to a whole bunch of VCs, a lot of them, and I'm not exaggerating when I say over 100. I still have a pipeline in the CRM that I keep track of which VCs, and we couldn't raise any funds from venture capital because everybody's afraid of healthcare. They're afraid of very long approval cycles. So an average to convince a hospital to adopt the software, if you're lucky, it averages 12 months. And of course, there's PHI, so it has to protect patients' information. All the encryption has to be there, and all the infrastructure has to be there. And we just went to friends and family who knew that we weren't going to take the money and run, and raised a little bit of funds, just enough to hire a few engineers and build a prototype. And now we're kind of in an interesting spot where we're not running out of money. We're extremely frugal, to the extent where we're having to balance things out, or are we overdoing it? But that gives us a lot of flexibility into, we're not worried about the margins or the profits or the quarterly reports, even though we do send quarterly reports to friends and family that have trusted us throughout the years. But we have the flexibility, and I realize that it may not be there forever. We may engage with more institutional investors and raise funds to be able to invest more in technology and get it to where it can address larger scale problems. But for as long as we can, we'll try to hold on to this spot that we're in, where there is no pressure on multiplying the company value. It's really growing the exposure. I love the idea that post-acute providers can engage at no cost. When we started, we were naive, I think, to a benefit, thinking that we're the only ones. And then it turns out we're the only ones dealing with the underserved population, the Medicaid, the complex cases. And then hospitals quickly said, we use your software for these, but we also use other software for the traditional care transitions to skilled nursing to home health. And we've asked them to do what you do, and they've been telling us for years that they would do it, and they never got into it. So do you want to do what they do? We'll tell you how to do it better. And so hospitals really, social workers helped us grow to where we are. But it's funny, when we talk about technology, many hospitals still today across the country, if you go and look at how they send patient records to the possible next level of care providers, is faxing. There's still a lot of hospitals, because faxing is considered PHI compliant on the federal level. So, there's, I can go into a tangent there, but I'll stop. And so a lot of what we do at a basic level is just stop case managers and social workers from wasting their time by a fax machine. I don't know any nurse, case manager, or social worker that got their master's so they can spend hours per day next to a fax machine, on a basic level, right? And then beyond that, that's when you get into what are the cool things that we could do, right? So we're looking at partnering with Findhelp and think about the person, not just as a patient, from hospital to the next level of care, but more of like how you can get the best outcome for that person with the adjacent services. Because what we do is clinical care transitions, right? So patient had a hip surgery, they can't go back home, it's not safe, they're going to go to a skilled nursing facility for rehab, or they had a car accident or something. But that same patient, if they have insulin, and they don't have a working refrigerator at home, that insulin is not going to be effective on sitting on the counter, and then that patient's going to end up in hospital with a spike of sugar levels. And it would have been cheaper for the healthcare as a system to buy a fridge for that patient than have the patient come back to the ER. Patients come back to the ER for quote-unquote pain, physical pain, when they really need food. And thinking, when it comes to technology, thinking about the adjacent services, right? The dental service, the food security, it really helps the entire healthcare system reduce costs and reduce the burden on the health system as a whole. But yeah, we're dabbling into machine learning and big data and all the fancy words around technology these days. We're playing with algorithms to look at providers that have the best outcome for patients with similar diagnoses. So we're looking at like the entire market, which post-acute providers have a recent track record of taking care of patients with similar needs, and the patients successfully going home. And bringing that information at scale back into the hospitals and empowering the social workers and those patients when they make that choice to make an informed decision and say, look, we recommend these facilities, here's all the facilities, but you recommend these providers or these facilities because in the past 30 or 60 days, they've taken care of patients with similar needs, and they went home. Because everybody's afraid of a nursing home. But if you say, you're there and you're about to go home, and here's the best way to get home, that helps.
Yeah. And I mean, emphasizing a part of what you're saying in everything is that it's relationship-based care. It's
Right.
your relationship that you even have with the hospitals that's allowing you to grow in a very unique way. Erine, talk a little bit about, you've worked in the governmental sector, you've worked in different nonprofit organizations, and you started Findhelp as a social benefit company. There are certain challenges and certain opportunities with those models. Talk a little bit about what you face.
I'll get to that really quick, but I'm just curious, Julian, when you're in a sales cycle, what percentage of their decision is based on technology? Because you stated that the bar is low. In some cases, the alternative is facts. Is that why they're buying, or?
No, I mean, the challenges. Sorry, I interrupted you. The challenges with why it's so long for a hospital to adopt technology is not really technology. It's, of course, protecting patients' information is important, but also going through the clinical approvals and going through IT departments and the finance department and everybody involved. At the end of the day, we have operating costs, and while we don't charge post-care providers, we have to pay the bill somehow, and we have to charge the hospitals. So, proving the hospitals the ROI, and it's getting easier. To what Rebecca's saying, it's a small world. Everybody knows everybody, and once you do a good job, these hospitals, they know each other, and the leaders, they work in the same hospitals and have to transition. But I think I might not be answering your question.
Well, no, I think you are, in that if you think about in the healthcare sector, a lot of times the decision makers are doctors themselves or social workers, and these are people who have likely been lied to their entire lives. Sure, doctor, I'm exercising. I'm flossing twice a day. And so I think what we've experienced is that by showing up and really not selling them, but just explaining the problem to them, sitting down with them, they can pick up on trust pretty easily. And to your point, it is a small world, and if you violate that trust, then you lose your reputation, and then things go downhill from there. But I think sometimes people start a B corporation or a nonprofit because they sort of have that bad word associated with a for-profit model, and I certainly get and understand why. I mean, I'm an idealist myself, and went to policy school, but I think at the end of the day, it doesn't matter. I think what matters the most is if you show up with the intention of trying to help your customer, that comes through, and then you are rewarded. I don't know if you'd imagine you'd have 3 facilities and 2 mobile. You're building a business, and But I think what I like about this panel today is that in a world of technology companies, there's a lot of tweeting, and there's a lot of hype, and there's a lot of PR. But I think the panel today represents people who don't take that approach and are too busy doing the work. And then those are the type of people that end up being rewarded in life. It may not happen right away, but people begin to notice cumulatively. And one, I think by taking this approach, you feel good about how you're growing your business. And it feels slow. I've also got a lot of rejection emails from venture capitalists and investors and things like that. And it does have its benefits of being rejected early. Definitely attest to that. But don't get me wrong, I'm glad we are a B corporation, but I think sometimes people embarking on a social mission somehow feel like they have a pass in being a good business. And I think the hard lesson is that doesn't last very long. You have to survive.
Yes.
So I'm curious if y'all had other thoughts.
Survive.
I mean, it's such a great point. It's
Yeah.
like you have to have that business expertise. I mean, Amber, you were talking about it last night, just learning how to run a business.
Yes, I've spent a lot of time. I had to shift my mentality quite a bit, and I had to do a lot of self-work and learn how to let go, because I was the one, boots on the ground, doing everything and caring for everyone. And then I had to make a decision. I remember, I think a couple of years ago, I was sitting there and my husband looked at me and he said, well, I think you're at that tipping point. You either go big or you go home. Like, what are you going to wake up in 10 years and feel like you fulfilled the mission you set out to do? Like, where are you at? And I just said, no, I'm not done yet. I just have too many ideas, and I can't sleep at night. I physically couldn't sleep at night. And he said, okay, well, you're gonna go big. And I said, all right. So what I had to do was let go and find the other people around me to support my work and my ideas and put trust in them to care for people and train other people to care for people, honestly. And everything I do is with the help of community. I think that's my most favorite thing about what I do. But I had to learn to be a better businesswoman. I had to learn how to make cuts when I had to make cuts. Like I had to admit to some things that I didn't do well at, and that weren't okay. And so that's been a huge growth thing for me. I had to enroll myself in learning about business and leadership, and be very intentional. And that was just as important. I had to tell myself that's just as important as caring for the kid that doesn't have a toothbrush or has an abscess, or so I was able to find the other people to start caring for those people, and then step aside and really hone in on learning these things. I'm in the thick of it right now, so but yes, it's super important. I've watched a lot of other nonprofits close around me, especially in the last 6 months. And I worked very closely with those leaders, and I've had very hard, purposeful conversations and said, what went wrong? Like, I want to know, because I want to learn. I want to, and what you said is, oftentimes, especially with the nonprofits, like, they don't value or invest in running the actual business. It's a business at the end of the day, and you can have the biggest heart in the world, but that doesn't always get you everywhere. And so there has to be a balance. And so, yeah.
Yeah. In fact, sometimes the heart gets you nowhere, right? Mm-hmm. Sometimes as a nonprofit leader, you can be so driven by the mission that you lose sight of the organizational infrastructure necessary in order to be successful, the revenue model necessary in order to be successful. Those aren't bad words. They're actually essential components of anything. Your home has to have, your family has to have an infrastructure. You have to have a financial operating system and a revenue model just to run your family. So a nonprofit is not absolved from those things. And oftentimes nonprofits, one, think they're bad, and two, think that they don't actually have the skills necessary. So as the years have gone on with us, every time, from an entrepreneur state, you kind of do it all. And then as you grow, you do fewer things more, and then fewer things more, and fewer things more. And I realized a few years ago, I suck as a technology developer. But I'm not the guy who should be running our product team, because I just am too quick to go left or right and not stick to a process that is actually necessary to make something really, really awesome. And so we started bringing people in who could run circles around me, and they do a much better job at those things than I've been able to do. And so maybe one of the lessons in this whole process, whether you're for-profit or not-for-profit, it doesn't matter, is trying to increase your capabilities so that you can do a better and better job at what you're trying to accomplish.
Mm-hmm. Yeah.
Yeah.
And we're going to open things up for questions in just a moment. But I want to talk a little bit about one thing before we do, and that is what all of you have mentioned is collaboration. Even in this panel, like, oh, we have that in common. And last night, Julian, you said to Amber, if you need anything tech-wise, just let me know. Like these types of connections that are so valuable and so important, and that you can work with, and you can work with each other. Talk maybe a little bit about specific collaborations and what they've meant to the work that you're doing.
Yeah, before we go into collaborations, I was going to say to what both of you touched on, letting go and hiring people and getting team members that are really good at one thing and let them handle that part of the business. I think we've been very fortunate, as I said earlier, when we were struggling to fundraise and we were bootstrapping, we've been very fortunate to get team members that joined early, not for the money. We have employees that started with minimum wage and no minimum wage, just stock options, just stock in the beginning of the first couple of years of the company. And it's funny because my now co-founder Michael once told me a long time ago, said, and he had a job at Microsoft headquarters, and he was in charge of a large team and making a lot of money, and he was telling me, like, money's not that important, and I was telling him, yeah, sure, from your position, I'm sure it's not, yeah. But it's funny because years later, I had a different job and I was making good money, but I was like, I see it now. And then we ended up, throughout the years, hiring people that didn't join for the money. And they really liked what we were doing. And now, of course, we hire and pay industry salaries and all the benefits possible, healthcare and dental and all of that, and 401k. But I want to touch on that. It's so important to get the right people on the bus. To get the right team members, and I'm still learning to let go, Amber. I'm very there with you.
It's hard.
I'm still like, they're not going to do it as good as, but maybe they'll do it better. So learning. Yeah.
So collaborations, anything?
I mean, what I love about our work is we get to find out about pretty amazing stuff and that we're doing. And when we're brainstorming how we wanted to sort of end this season, these are 3 people that I've met along the way and have been inspired by. I think at the end of the day, it is impossible to boil the ocean. I mean, that's why that statement exists. And understand what I liked about Adrien the most is you get in a meeting with him and he's really good at focusing the meeting and focusing the product vision as well. And his team is very disciplined at that as well. And I just admired that. But you can only do so much. You have to just say no to scope. And I think I've heard you say that, Amber. And the good news is what technology has enabled is the ability to actually do that effectively through APIs. So at least for our company, we're never going to be the next Epic, or the next big gigantic Salesforce or whatever. But if we can get really good at staying in our lane and then allow APIs to be used by partners who are very, very good at engaging churches, for example, or the foster care system or post-acute care, or you then have the benefit of both. So we're working on an integration with AIDA. We don't have all of these nursing homes and post-acute facilities as users of our software. And that's okay because AIDA does. And so imagine a world where you're doing a search, you're helping a mother or a grandparent transition from the hospital, and you can not only discover a benefit that they can apply for and get food delivered because of the insurance that they have, but also eventually make a referral to a nursing home that actually is where she can recover at, close to your house, just in a few clicks. And I think that's possible. We're never going to go get the 80, however many thousands of 49 states worth of post-acute providers.
Delaware.
Delaware. But by spending a few hours together over a period of a few months and testing the concepts and getting all the ducks in a row, that allows our users the benefit of Julian's work and then hopefully vice versa. I think that's how you have more and more impact, by staying focused and frankly surviving.
Yeah, I'll piggyback on that, just because the idea of collaboration is central to what CarePortal does. Any multi-sided market platform has to bring together folks from different angles, and for us, it's a really, really complex, because we are literally partnering the faith community with government in many places, and we have government agencies in 38 different states that use our platform, and in those very same states, in the communities where the people live, we're partnered with 7,000 or so churches and hundreds of businesses. And so pulling the idea, what you said about staying in your lane, like our role is very, very narrow. And since we know that, we double down there. Getting that collaboration to happen can be tricky. It can be difficult. I was in Boston the other day, and unfortunately, the leadership in Boston has a very negative narrative about the faith community, and it's a barrier to work through. And so I find it as a privilege, though, to figure out ways, like you guys are figuring out right now, like how can we collaborate, and how can I be used as a vessel to create something more out of the ingredients that already exist, because we put them together. Like that is a deep desire that we have, and a lane that we run in. So frankly, CarePortal wouldn't be anything if we didn't collaborate.
I took a class on philanthropy in this building, actually, and the one thing I remember from that class is that the reason why people don't get involved is because they're not asked. And I was like, that is really profound. So the work that you're doing is not only asking, but like really allowing people to connect. It's pretty amazing. We're going to open things up for questions. There is one microphone right over here. Is there another one, Renee? Or just that one? Just that one. Okay. So take a journey, if you will, to this microphone. Feel free to not ask a question, but should you want to, please do. While we're waiting for people to line up, you all have big missions that are coming up. Amber, I'd like you to talk a little bit about where you see your efficacy in the next 10 years.
Yeah, so what I learned from all of these things is there is a huge policy piece to what I do, and that was definitely not on my radar when I started out. I mean, I, honest to God, truth, just wanted to go out and take care of people on the ground, where they're at, with my car. Like, it was very basic. But it's so much more than that. You know, yes, that's great, and I can only do that if all the other parts work too. It's only sustainable if I can, you know, bill for services, if people have access to not just dental things. So my eyes have been opened, and I've worked a lot in the community with others, and that's the only reason why I can do. But through that, I've partnered with a lot of places and to help get billable codes for teledentistry, scope of practice changed in the state of Maine, so I can deploy these people into the community to do the work. So through that, and through that experience and having to lean and rely on others to help me do those things, I've really gotten into policy, which was, again, not anything I would do. So that's where I'm headed now, and I've become quite passionate about it, and I'm hopefully going to go back to school and do that. So
just let us know how we can be involved in your campaign.
Thanks.
So go ahead if you just introduce yourself.
Hi. Am I audible? Yeah, I think I am. I'm Rabita. I'm doing a graduate course in engineering management at the moment with UT, and I have a background in software engineering. So I wanted to ask, as leaders who are in a scope where you're working with social causes and you are technology-based, but as you say, you're not technology firms in themselves. In this climate, do you feel pressured to include maybe the most cutting-edge technology in your pitches, or when you're talking about your companies, for example, like including AI, even if you don't feel like you need it right now, just because of the conversations happening right now?
That's a good question. I get asked about AI all the time. Frankly, I don't understand it. I guess it's okay to say publicly. But it can be a distraction if it's not core to what you do. And I guess I would just say is it is okay with whoever's asking about it, because they might be happy about it, they might be excited about it. It's okay to say, well, I think this is the problem that we need to solve first. There are avenues in which generative AI is going to be really good. For example, like the user interface is phenomenal with Chatty over there. And it has its place. It's still new. It's really good at, for example, I'm watching this Netflix series, and it's sort of based on some good Western shows, like a little bit. It seems like Friday Night Lights and other things. But it is so bad that I'm convinced it was written by AI. It's just not there yet, but there are elements of it in which it is going to help our business better. For example, when you do have lots of data, how do you know? My guess is, maybe AI could get good at prioritizing messages you get from patients. You know? Maybe not responding to the patients, but maybe just saying, hey, Amber, you might want to talk to this one. I guess what I try to say is just stay authentic, and if it's okay to say, yeah, if there is going to be an aspect of it, but I also am trying to learn about it as well. But there's been so many things along the way that it can be a distraction. For a while there, it was whatever it is. Advanced technologies that kind of come and go. But I think this is much different, but it feels like we're in the early innings of it, and you should know something about it. But if it's not core to your project or your business, I would say resist that pressure, or else it's just another distraction.
I have 2 cents on your question. Specifically in healthcare, when you think about the risks of getting things wrong, today that goes on who got it wrong. Was it a human being? Was it a doctor or nurse? But if it's AI, then it's like, well, AI got it wrong. So what does that mean? If you look, there's companies that have been in lawsuits that paid hundreds of millions of dollars in fines for using AI, where AI got it wrong. So I think in general, we talked earlier about the approval process to get our software in hospitals and providers. Today, more often than not, we see that if you have AI, then your approval is going to go so much longer and so much more rigorous for a good reason, because people got hurt. And so what I've seen a good implementation of more modern technology is first think about the risks, and it's a good idea to have a safety step in between the actual effect and like having a human being to say the AI is suggesting this, but the human being should be the final one to say, no, the AI's got it wrong, or the AI's got it right, and so that's a good way to think about it. But basically, it could work as a negative for business as a whole, because it could really slow you down from your technology being adopted, and you might not make it. Personally, at AIDA, we look at all the cautionary tales out there and start small and adapt a little bit at a time and really think about the risks and try to think about the safety steps in between.
Thank you so much.
I'm going to swing a different direction, just a different direction. I don't necessarily feel an external pressure to talk about AI or whatever, but I do feel an internal pressure to gain in efficiency. So as a nonprofit leader, I feel like how we do what we do is very expensive, and there has to be a more cost-effective way to do what we're doing. And so I'm looking to leverage whatever I can to make our operations better, not an external pressure, an internal pressure. That's my take.
Yeah, thank you so much. Those were amazing insights. Thank you.
Next question.
Hi, I'm Clara Ann. I'm community health specialist here within Austin. So I'm one of those people who's connecting the healthcare with the community resources. How are we making sure that people are connected? And I really feel like what I've understood is what you were saying about efficiency. We're using technology for efficiency so we can focus on the people and the personal touches that we can have. But at the same time, how are you getting feedback from your patients, from your clients, from those foster kids? I mean, you're talking more about on the higher up, the healthcare institutions, those providers, the social workers. But what about those people specifically? How are you getting their feedback into the system?
Who are you asking on that one?
I mean, I feel like it applies to all of you.
Yeah.
As far as, are you getting the foster kids positions? Yeah. Are you getting those people on the streets with their dental skills? Are you actually getting those patients' feedback on there, or is it just within the system and how that integrates into our software?
I can tell you, we are getting the feedback. We've integrated surveys. We host groups where we invite parents, some like foster teens, and we do feedback. We try to do this quarterly. It doesn't always work out quarterly, but we are trying to improve our outcomes and really kind of change our care and make it better based on that. That is incredibly important to me in the work that I do. And I'm still working on getting better at that. But I think that's something I'm trying to use technology to make that easier for people. That's where I'm at right now. But yes, we do a lot of very intentional work to make sure that the people we're serving are being heard. And I'm constantly right now, because we're in the pilot, getting feedback of on a weekly basis of how people are using this app and what they're running in. We're getting that feedback. So I feel like we're really in the thick of it, but we are kind of trying to roll that out actually across everything we do, like all of our work. But yes, we definitely do.
I can add 2 cents really quick. Early on, I was spending a lot of time at the front line with the actual users, both on the provider side and on the hospital side. Just asking questions, paying attention, look at their frustration, and bringing that back into the engineering team to affect the roadmap. Today, we have it as a company policy that everyone in the company needs to go spend time with the frontline users. So product managers, they go spend time with the actual social workers and case managers and a whole day and see how they work and what's working, what's not working, and how things could be improved. So just spending time with the customer is really, really, really helpful.
Well, we're getting toward the end, which is crazy. This has gone so fast. But I want to ask each of you, we started with your aha moment, your moment where you saw a problem and you thought, oh, I can do something about that. I can change that. What advice would you give for all of us today, especially students who are just kind of starting out in their careers, seeing problems and not really knowing where to begin? What advice would you give them as to how to assess the problem, how to get started, how to keep the faith, how to continue the work, make collaborations, make connections? Talk a little bit about what you would tell them. Go ahead.
Yeah, the first thing that crossed my mind is it's not likely that you're the first person who sees that as a problem. Somebody else has already thought about this too, or is thinking about it now, or somebody else is probably trying to do something down this path. So as enticing as it is to go forth and do your own thing, it's really wise to learn from who is out there, who's trying to approach this, who sees the world the way that I see it and is taking an effort towards solving this problem at hand. And if it's possible to come alongside them because your visions align and the solutions you think about align, or you're learning from them, then join an effort that exists. That's like join something that's there before you set forth to do it on your own. Going off and doing it on your own is a solution when it's not already in place, right? But you have to learn first. So While there's everything in me wants to innovate constantly, just how God made me. I see a problem and I want to I want to find a solution. If I'm finding like, I think, oh, I just solved the world's greatest problems and nobody else has, there's nothing new under the sun. That's my point. Like there's something out there to learn from. And so humbling myself to recognize that as a posture is way better than trying to blaze a trail by myself on the front end.
I think for me, I'm definitely a big picture person. I see all the big things and I see it all at once and it comes at me and so many ideas. And I think just slowing yourself down, and maybe you're not that person, but finding out who you are as like a problem solver, as a leader, like really understanding yourself and finding one small thing that sparks passion in you, and then doing all the research, like you said, of what's come before you, and then figuring out a small thing you can do to try to fix one problem, and then aligning yourself with other doers that are in that same, because it can feel very lonely when you are sometimes passionate about things other people often don't care about, or you feel like the weight of the world is on your shoulder because like you're noticing all these problems. But yes, figuring out who you are, and what drives you and what gives you that fire, and finding that one small thing that makes you passionate and going with that, because that really can open the doors to so many other things.
I think it's a good idea to try to find a balance between being naive and doing some research. I think it's easy to get stuck in analysis paralysis, where you're just going to go and do all the research on that problem, how to solve it, and you might never start doing anything. I have a good balance with my team. They bring me back down to earth. I'm in like, let's go. You're overthinking. Let's just do something. Let's go. And I don't like overthinking things. I just enough to where I can see that it's going to work, and let's start actually implementing it. So I have team members who are the opposite, and so we balance each other out. I'd say that's how we find a balance. Is one is overly optimistic, and one is maybe more realist / pessimist, and then that balance, those things balance each other. So that's one thing. Just a little bit of being naive to a certain degree helps, I think. I don't know, just finding people that are smarter than you and trying to get them to join the team. It's really helpful. Yeah.
It's amazing how random all of our lives can be in what we do with our careers. Sometimes we make decisions based on the recruiters that come to the college that we went to. But at some point, somebody's going to look around and say, I want to do something different with my life. And my advice to that person would be, one, to go buy a journal and a pen and write about it. I think that practice has served me well in figuring out what it is. Is it noise, or does it stick? Do you find yourself still thinking about solving these problems? But then another thing that I would say is that you're gonna, with your career, you can change, but find a problem that you can't stop thinking about. And I think that is the thing that gives you meaning. And to Adrien's point, find the other like organizations. And, if you care about the cause, if you care about the foster care system, or whatever it is, you're going to move your way up if you just work hard. Mm-hmm. It's really not any more complicated than that. But sometimes we get stuck in the notion of, well, I'm going to go here and get really good at, let's say, accounting. Well, maybe accounting isn't your thing, but, well, that's what I got my degree in. It is okay to go ahead and make that change. But I would also slow roll it for a while. Write it in a journal. If you're still writing about it 3 months later, you're probably meant to go do something like that. And then go find good people like these folks and go support it.
Yeah. At our last show, you asked, what keeps you going? What keeps everybody kind of doing the work that they're doing and energized? and you've focused on doing the work even in the face of huge challenges. And I think, Erine, you said you got a dog, or you said no. Jaffer said, Erine told me to get a dog, so I got a dog. But I would like to hear from each of you. What drives you on? What keeps you going?
Oh gosh, fear of failure. That's part of it. I just think this problem that we're working on is solvable, and I want to be a part of solving it. It's really not any more complicated than that. It is a solvable problem, and I think it's clear, what could happen in order to solve it.
I like what Amber said earlier. It's easy to get lonely, especially the first couple of years, and we had engineers building the technology. With no customers, no patients being affected for at least a year and a half. So what I did often, because I would go and talk to social workers and nurses and hospitals, and when you talk to them and they're like, "Oh, we need this so badly, really, we would use this right away." And I was thinking, that's what energized me. And then what I would do is I would literally ask them, "Do you mind if we do this again?" And I'll bring the engineers. I really want them to hear how you feel about what we're doing, because they're out there in the cubicle working hard, and I have no idea if this is going to turn into anything. And so first couple of years, I'll bring the engineers to my presentations to hospitals, because that energy from the actual hospital staff that were providers, that they were so excited that they will know who has availability, and they won't have to make 100 phone calls to figure out where's that available bed. They were so excited about getting their job, because it's really what it is. It's our users, they went to school to provide actual care for people, not to phone tag and fax and do all these things, right? So getting their energy is really fueling that tank of wanting to keep at it.
Yeah, and seeing the impact of their work.
Right.
Amber?
I was told no a lot, and that energizes me. No is super important. I've learned how to say it more, but I don't like being told no. So
Watch out.
that keeps me going. That really energizes me. And when people think something can't be solved, because I do think there is always a way. So those things, and then by having a support system at home is very important. My husband and my kids have been, it's hard to do this work. The work we do is hard, and it takes all of you almost all the time. And sometimes you lose yourself, and you have to refine yourself many times along the way. And you wake up some days and say, "Why am I even doing this? Is this worth it?" And it's always worth it. But so those are the two things.
Family, yes.
Family is really important.
I'm getting in trouble at home. My wife, a lot. Seriously.
Yeah.
Just two quick things. One, super personal to me. I really believe that I was going about my business, and God gave me an assignment, and I'm just living out my assignment. So I feel like a soldier who's living out what he was supposed to live out, right? But the second thing is day to day. I mean, you guys all do this. You can download the CarePortal app, and you can look at the requests that are open in Austin as we speak, and you can look at the stories of those families and who live in your zip code. And I get to see those stories every single day come through, and I get to hear the process of caseworkers and church responders and business owners who are all collaborating to help meet this family's need. And I get to hear the stories afterwards of the life transformation that happens because a neighbor showed up to serve their neighbor, and both are transformed in the process. And so for me, it's like, it's working every single day. And that is very inspiring to see people's lives change because a neighbor decided to serve their neighbor.
Yeah. Well, Adrien, Amber, Julian, Erine, thank you so much for joining us for this panel. Thank you all for coming out. Please stay for lunch and have a wonderful afternoon. Thank you.
Thank you.